Welcome to the CABG Masterclass on Coronary Artery Bypass Grafting, Nursing Clinical Mastery, brought to you by Nagesh Sir, ND Nursing Coaching. Let's begin with a question. Which graft is considered the gold standard for CABG due to its high long-term patency rate? Is it the saphenous vein graft, left internal mammary artery, radial artery, or right gastroepiploic artery? The correct answer is B. The left internal mammary artery, or LIMA, has superior long-term patency compared to venous grafts because it is an artery and resists atherosclerosis better. Next question. What is the most serious potential post-operative complication of CABG requiring immediate recognition? Is it post-pericardiotomy syndrome, cardiac tamponade, atrial fibrillation, or atelectasis? The answer is B. Cardiac tamponade is a life-threatening medical emergency. It is characterized by fluid accumulation in the pericardial sac, which compresses the heart and reduces cardiac output. Which clinical finding is a classic sign of cardiac tamponade post-CABG? Is it a sudden increase in chest tube drainage, sudden cessation of chest tube drainage, hypertension, or bradycardia? The answer is B. A sudden cessation of chest tube drainage can indicate clot obstruction within the tube, trapping blood in the pericardial space and leading to tamponade. Which of Beck's triad symptoms is associated with cardiac tamponade? A. Hypotension, JVD, muffled heart sounds. B. Hypertension, tachycardia, crackles. C. Fever, chest pain, friction rub. Or D. Pulsus paradoxus, bradycardia, edema. The correct answer is A. Beck's triad includes hypotension, JVD, and muffled heart sounds. This is the classic clinical presentation of cardiac tamponade. What is the primary nursing goal during the first 24 hours post-CABG? Is it early ambulation, maintaining hemodynamic stability, preventing pneumonia, or wound healing? The answer is B. Hemodynamic stability, which includes BP, HR, and cardiac output, is the highest priority. This is due to the stress on the myocardium and the immediate risk of post-op complications. Which medication is typically started post-CABG to maintain graft patency? A. Aspirin, B. Warfarin, C. Heparin, or D. Metoprolol? The answer is A. Antiplatelet therapy, primarily low-dose aspirin, is initiated to prevent platelet aggregation and thrombus formation in the new grafts. What is the most common rhythm disturbance observed after CABG surgery? A. Ventricular tachycardia, B. Atrial fibrillation, C. Sinus bradycardia, or D. Heart block? The answer is B. Postoperative atrial fibrillation, or POAF, is extremely common after cardiac surgery. This is often due to electrolyte imbalances and pericardial inflammation. When should the nurse contact the surgeon regarding chest tube drainage post-CABG? Is it 50 milliliters in 1 hour, 100 milliliters in 1 hour, greater than 200 milliliters in 1 hour, or 20 milliliters in 1 hour? The answer is C. Excessive drainage, defined as greater than 150 to 200 milliliters per hour, indicates potential postoperative hemorrhage and must be reported immediately. What is a key nursing intervention to prevent pulmonary complications post-CABG? A. Continuous suctioning, B. Incentive spirometry and deep breathing, C. Strict bed rest for 48 hours, or D. Keeping the patient NPO for 2 days? The correct answer is B. Incentive spirometry, deep breathing, and coughing are vital to prevent atelectasis and pneumonia, which are common pulmonary complications. What is the most common reason for graft failure in the early post-op period? A. Thrombosis, B. Vasospasm, C. Hypotension, or D. All of the above? The answer is D. Thrombosis, vasospasm, and hypotension all contribute to graft failure in the early postoperative phase. What position is generally avoided in the immediate post-CABG period? A. Semi-Fowlers, B. Flat supine, C. Right side lying, or D. Left side lying? The correct answer is B. Flat supine position is avoided because it can impair ventilation and increase the risk of atelectasis. Semi-Fowlers is preferred. Why is potassium maintained at a higher level, for example 4.0 to 4.5 MEQL post-CABG? A. To prevent hypertension, B. To reduce the risk of arrhythmias, C. To prevent constipation, or D. To increase urine output? The answer is B. Higher potassium levels are essential to stabilize myocardial cell membranes and reduce the risk of life-threatening arrhythmias like atrial fibrillation. Mediastinitis is a serious infection of the chest cavity. What is the most common presenting sign? A. Fever and chest wound drainage, B. Bradycardia, C. Hypertension, or D. Hypothermia? The correct answer is A. Fever and purulent chest wound drainage are classic signs of mediastinitis, which is a severe complication requiring aggressive treatment. Which lab value is the most specific marker for myocardial damage? A. CKMB, B. Troponin I, C. LDH, or D. AST? The answer is B. Troponin I is the most specific and sensitive marker for myocardial injury and is routinely monitored post-CABG. What is the splinting technique used for post-CABG? A. Using a belt, B. Holding a pillow against the chest while coughing, C. Bandaging the sternum, or D. Bracing the arms. The correct answer is B. Splinting involves holding a pillow against the sternal incision when coughing or deep breathing to minimize pain and protect the sternal closure. Which fluid balance trend is most concerning post-CABG and suggests third spacing? A. Increasing urine output, B. Positive fluid balance with decreasing urine output, C. Negative fluid balance, or D. Stable weight. The correct answer is B. A positive fluid balance coupled with decreasing urine output is a sign of third spacing, which can lead to complications such as pulmonary edema. Which assessment is most important to evaluate cardiac output post-CABG? A. Blood pressure and heart rate, B. Hourly urine output, C. Capillary refill, or D. All of the above. The answer is D. All these assessments, including BP, HR, urine output, and capillary refill, provide vital information for evaluating cardiac output and tissue perfusion. What is a major neurocomplication of cardiopulmonary bypass, or CPB? A. Stroke, B. Seizures, C. Confusion/delirium, or D. All of the above. The answer is D. CPB can lead to all these neurocomplications, primarily due to microemboli or global hypoperfusion. What is the expected urine output post-CABG? A. Less than 10 milliliters per hour, B. Greater than 30 milliliters per hour, C. Greater than 1,000 milliliters per hour, or D. None. The answer is B. An expected minimum urine output for an adult patient is greater than 30 milliliters per hour, indicating adequate renal perfusion and cardiac output. Why is sternal instability a concern post-CABG? A. It increases infection risk, B. It causes severe pain, C. It causes breathing difficulty, or D. All of the above. The correct answer is D. Sternal instability can increase infection risk, cause significant pain, and impair respiratory function, making it a serious complication. Which electrolyte imbalance is common post-CPB? A. Hypocalcemia, B. Hypernatremia, C. Hyperkalemia, or D. All of the above. The answer is A. Hypocalcemia is common because the anticoagulant used during CPB binds with calcium ions, requiring close monitoring and replacement. What is the purpose of pacing wires post-CABG? A. To monitor blood pressure, B. To treat bradycardia or heart block, C. To deliver medication, or D. To stabilize the sternum. The answer is B. Pacing wires are temporarily placed to treat slow heart rates or conduction disturbances that may occur postoperatively.